saying that I consider it a privilege to be talking about men's health, and the reason for it to be evident as I speak. You know, men's health is huge, and men's health affects countries, affect companies, affect families, and therefore we looking after ourselves is very, very essential. I'm going to share my slides and I'm going to talk through them. Now, let me say that basically I will do some introductory statements, and then I hope you can see my slides, everybody.
Yes, we can. Yes, we can.
Okay, that's fine. Okay, so that's my introduction. I'm a CEO of a medical center in Tema, and I'm also a CEO of Ginger Healthcare, and I'll talk about them at the end of the session. The outline of my presentation is basically some opening comments about men's health, which I'm going to do on this slide. And then I'm going to talk about the 5 big boys in terms of men's health: strokes, heart disease, diabetes, kidney disease, and the almighty prostate. Now, I'm hoping that once we've got through this, that will give you a sense of what we really need to do. I'm hoping that people will go away with some kind of a message on what they need to do to look after themselves, and by extension, their families, their companies, and their country. Now, why men's health? Men's health, on average, men on average die younger than women. Now, that's something that we've known in the medical fraternity for many years. But we also know that it's not a very easy issue to tackle. Why are men so poor at looking after themselves? But that's basically why we're here. Education is one of the missing pieces in this whole saga. And therefore, educating men is an essential thing. And I think that I hope that these kind of things take place in other platforms. And I really commend the leadership here for putting this together. Men tend to exceed women in 12 of the 15 leading causes of death among humans. And I'll show it in the next slide. Men are less likely than women to seek medical care. Now that is obvious, but also it's also because women tend to go to the hospital because of children and because of pregnancy. So we tend to pick up women's problems early and are able to help them to navigate a sensible, lengthy life with reasonable health. But men don't go to the hospital except they have a problem or they're quite unwell. And sometimes that doesn't really work well for maintaining a healthy lifestyle or having a long, healthy life. Among men, those who belong to racial and ethnic minorities, and blacks obviously form part of that group, are particularly at risk of poor health. Men's health issues impact everybody. And if you take no message out of what I say, please take this home. This is my lessons for you to take away, that your health as a husband, as a company leader, as a leader in an organization, is so important. If you are not taking care of yourself, it's affecting everybody. Very, very important point for us to keep somewhere. More than half, now listen to this, more than half of elderly widows living in poverty were not poor before the death of their husbands. So our ladies are great and they do a lot of wonderful things. And please, we cannot take away from them the amazing contribution they make to the family. But there's no exaggerating of a man's impact in his family's economic status. The loss of a man in a family is a big deal. It's a really, really big deal. I mean, I cite myself as an example. My mom died when I was 4 years of age, but because I live with my dad, he ensured that all of us went to school, finished university, and then went on to do professions for ourselves. Now, if it was the converse that took place when my dad passed away, I'm sure my mom would have had quite a lot of challenge trying to do exactly the same thing. So I'm saying that without coming across as exaggerating or arrogantly expressing what men do, men are huge in terms of maintaining families, maintaining companies, and maintaining country. Now, these are the 15 leading causes of death in the Western world, and indeed in most parts of the world as well. heart diseases, cancer, stroke, chronic obstructive airway diseases, we call them COPD, very common in men that are smokers, accidents, diabetes, Alzheimer's, influenza, and pneumonia. Now, for all of these listed here, you see the male to female ratio is always more on the male side. As a general rule, for most things, men are about 1.5 times more likely to die from it than women. That is also true even for the COVID. We know that in the COVID, more men have died from the COVID than women. So men generally are more at risk or tend to die with illness than women do. Now, if you take the leading causes, so the leading causes for men are the following: heart disease, cancers, unintended injuries, strokes, chronic obstructive lung diseases, diabetes, influenza, suicide, kidney disease, and Alzheimer's. So obviously, Alzheimer's form a very, very small part of things that lead to men's death. But the big boys, heart disease, strokes, diabetes, kidney disease, and cancers are really dangerous. They are dangerous because they ambush you when you least expect. They crawl on you over time without you knowing they are actually causing you damage. And that's why I'll be focusing the rest of my discussions on them. But let me just show you this slide. I don't know how many of you have come across this doing the rounds in the WhatsApp space. The leading cause of injury in an old man is them thinking they are still young. And a lot of men get to injure themselves and then go through a period of morbidity, eventually leading to complications of health and then death because they think they are still young. Now, I'm sure most of you here on the platform will probably be like myself, 50 and over. And if that is the case, then we should have some respect for very physical work. If there's work that we cannot do, we should, let somebody younger and stronger do it. We protect ourselves and our families if we make these wise choices. So back to the list that we have here. I'll be going through just 5 of them, and I'll be talking about why. I'll be giving some more details about them, and then giving us some preventative ideas to go and think about. In the end, a lot of these conditions have about the same pieces of preventative activities we need to undertake. And if we take those away today, we should be able to protect ourselves even against the ones that we did not discuss in our deliberations today. So I'm going to start from heart disease because that's the biggest one, really. The leading cause of death in both men and women in the Western world, and it's more so in men. It's a bigger problem among men, as I said, 1.5 times that of women. Heart disease normally will present as what we call coronary artery disease or coronary heart disease. Now, what does that basically mean? It just means that the vessels that are running around your heart, supplying blood to your heart, sometimes are impaired. The blood flowing through them is obstructed, and therefore it doesn't have free passage to go to all the places that it needs to do. If that happens, then what happens is that the parts of your heart that does not receive blood starts to cause you pain. Now, when it starts mildly, you start to have just a bit of chest pain in your chest from time to time. It's either comes in waves or comes and goes. And you may not take much notice of it. But as it gets worse and worse and the blockage gets bigger and bigger, you start to have pain that is persistent. I'll show you an example. So if you look at this picture, this is blood supplying the front part of the heart. Now, when there's a blockage, and normally the blockage comes from fatty deposits that are sitting in the vessels, presumably from what we have been eating. Fatty food is very nice, but the problem with it is that it's also a very, very dangerous diet. It deposits in the vessels, and over time build a little molehill that, if it's sited in the wrong place, may meet another one, and then they'll completely block off your vessels. When this happens, blood flowing through the vessels are impaired, and the blood flowing to a particular area can be completely cut off. If you can think about it, if it's actually coming from the big vessel at the top there, the whole anterior part, the whole front area of your heart is completely cut off from its blood supply. It doesn't get nutrition, and over time, that part of the heart will die, and that leads to heart failure. So going back to our slide, it starts with chest pain and what we call chest pain or angina. But if it's not dealt with, if you don't deal with it quick enough, and you don't adhere to some of these things we are going to be talking about today, it gets worse and worse till it leads to an actual heart attack. Heart attack is just a sudden abruption or sudden curtailing of blood flow to some parts of the heart. It leads to severe chest pain, sweating, vomiting. I'll talk a little more about those in some of the subsequent slides. But the main thing it does is that it causes death of a certain part of your heart. And then that part of your heart is unable to pump blood. And therefore, that leads to heart failure, arrhythmias of the heart. Arrhythmias is where your heart is not beating with the same synchrony, the same rhythm that it's supposed to be. And your heart not functioning well is actually what leads to death. Now, men usually develop heart disease 10 to 15 times more, 10 to 15 years earlier than women will do, and are therefore likely to die in their prime of life. And these are the important things that, for a lady may also have heart attack, but it's more common and at a much younger age in men than it is in women. About a quarter of all heart diseases related deaths occurring in men occur between 35 and 65. Let's say that again. About a quarter of all heart disease related deaths occurring in men occurs from the age of 35 to 65. And we are well in the middle of those ages. And that's the reason why it's important to keep an eye on these things. And there's a tendency, if you are feeling healthy, to ignore and feel that because you are feeling well, absolutely nothing is happening to your health. But as we're saying, the big killers are also silent assailants. They will come upon you unawares. Symptoms of heart attack: you have chest discomfort, usually in the middle of your chest. It can last a few minutes or it comes in waves. It makes you feel heavy on your chest or a tightening or squeezing around your chest area. And sometimes it can extend onto the upper part of your body, causing neck pain or pain running down into both arms or jaw or stomach. Any pain like that is unexplained, and particularly if it's of sudden onset, needs to be attended to. You need to be seen somewhere. Then, on top of the chest pain, you also start to get shortness of breath, sometimes nausea, sometimes vomiting, or you start to have dizziness. Now, how do we prevent heart attacks? How do we ensure that it doesn't creep on us in the prime of our lives and we are unaware of it? The first thing to talk about, there are a number of things we need to do, but first thing is your blood pressure. So from the age of 40, it's really, really important, if you can, every year to check your blood pressure. Because as we get older, naturally we do have fat deposits in our vessels, and the vessels harden because of the fat deposits. They are not as malleable and as soft as they used to be when we were younger. They are because of the cake of fatty deposits in the vessels, they become quite hard and they are inflexible. They don't expand anymore and they start to let your blood pressure go up. The other thing you need to think about is cholesterol levels. Again, cholesterol start to go up in middle ages and upwards. Now, these are things that, again, if you don't go check, nothing will tell you from the way you're feeling that your cholesterol is high. And it tends to go up, particularly from age 40 upwards. Worsens with those with diabetes and those who put on a considerable amount of weight. To deal with cholesterol, you really need to think very carefully about what you are eating. I've said here that, one of the things that really help us, if you're dealing with cholesterol, is that we have to change the way, we have to change our nutrition, we have to change our diet. Go more for the fishy diet, the salmon, the mackerel, the herrings, chicken, turkey, and put away the pork and the fatty bits of meats and the oily stews and so on and so forth, because that will only make your cholesterol worse. Now, when you are taking your own steps to help you reduce your cholesterol intake, do check your cholesterol again. If it's still high, you need medication. And please, it's better to take medication than to leave yourself to continue with a high cholesterol, because it only increases the chance of you getting heart attacks. Keep a healthy weight, get regular exercises. Now, that's very, very tough on men. Very, very, very tough on men. So, but we need to do it. We need to do it for ourselves, for our families, and for our longevity. The other thing we need to do is, as I said, control your blood pressure. So healthy diet, reduce your salt intake, eat a lot of fruit and fiber. We've talked about exercise already. If you're smoking from 40 years, probably a good time to start considering quitting smoking. Keep an eye on your blood sugars and make sure they are under control if you've been told you have diabetes. If you don't control diabetes very well, it will give you problems with your heart. I'll say that when I start to talk about diabetes as a repetition, but a very important point to note. People with diabetes have a heightened risk of heart disease. Most diabetics will die from heart disease or kidney disease. So keeping an eye on diabetes is a really, really important thing. Smoking and excessive alcohol consumption has been linked with high blood pressure, heart disease, and strokes. Now, let's talk about weight. Let's talk about weight, because weight is something that naturally, as you get older, become more successful, get more settled in life and marriage and looking after your children, you sometimes, if you are not watching it, tend to put on weight. But how you look at the weight you gain and its impact on your life has been addressed or have been described by this concept we call BMI. It's a very well-known concept. So BMI is basically an estimation of your weight over your height. Very, very important that your BMI is within normal range. So if you look on the chart I have here, the green area is really where you want to be, where your BMI is between 18.5 and 24.9. If your weight is say 80 kilograms, so your weight is 80 kilograms, and your height is 1.7. Now, so if you look, you just go down the line for the weight of 80 kilograms and go down 170, you realize that it's just at the very top of the green bar. Now, that is just as good as you get it. If you are 1.66, 1.60, and you have a weight of 80 or more, your BMI is very likely to be in the upper yellow or the reds. The reds is not good at all. The reds is where all these diseases are hiding, and they can cause you trouble. So I'll suggest that after our meeting, find out what your weight is if you don't know. You really should. And if you don't know your height, check your height and then do the division. If you are more than 30, you are in the red zone. You really need to do something about your weight. It will help you. If you are between 25 and 30, you are in the yellow zone. If you are between 18.5 and 25, you are okay. Now, I would hazard a guess that most of us are in the 25s to over 30s. And every one of us have to do something about our weight. Now, if you are at risk of heart disease, from what I'm saying, so your blood pressure is high, you have cholesterol, then you really need to be thinking very carefully about additional steps you need to take. So we're talking about the fact that check your blood pressure and make sure it's controlled, check your blood sugar, check your cholesterol, and make sure it's within normal, or at least take action to bring it to normal range. But after doing all of that, if you are more than 45 years of age, or if you are younger than 45 years of age, but you have blood pressure, or you have a family history of blood pressure, if you have high cholesterol, or you have diabetes, or you're smoking, if you are doing any of these, or you fit into any of these groups I've just described, then it is important not just to be watching your height, your blood pressure, your weight, not your height, your blood pressure, your cholesterol, your blood sugars, but also to look at getting aspirin. Now, aspirin is a blood thinner. When we give aspirin to folks, it basically thins your blood and reduces your risk of forming clots in your bloodstream. We know that if we give aspirin to people who are at risk, it reduces their risk of heart disease, heart attacks, and strokes. So it's a very good idea that once you know that you are at risk, your weight is quite significant, your BMI is more than 30, you come from a family with quite significant concerns about hearts and strokes, you have high cholesterol, then speak to your physician about taking aspirin every day. Just 75 milligrams, a very small dose of aspirin, but it does work magic in preventing heart disease and strokes. Now, so that's all I'm going to say about heart. I'm just going to go straight to stroke. I've left a lot unsaid here because I just want you to give you snippets that allow you to go and think about what you are doing about your health in terms of heart disease. Now, stroke is very similar to heart disease, except that it's the same principle happening in the brain. Blood supposed to go to a part of your heart, of your brain, is curtailed because of a clot sitting somewhere in your brain, or because a vessel in your brain ruptures, and then the blood that's supposed to go to distal parts of your brain now doesn't get any more supply. So what it basically does is that the blood then goes around your brain and begins to cause pressure on the brain tissue. The parts of the brain that got its blood supply cut off also begin to die. And that is basically what stroke is. So stroke occurs when the blood flow to a particular area of the brain is interrupted either by a blood clot blocking the artery, or a vessel that breaks. This causes brain cells to start to die and brain damage occurs. Now, brain damage can lead to loss of abilities like speech, movement, memory, and so on and so forth. Now, what are the symptoms if you are getting stroke? Well, basically, you have sudden onset of numbness or weakness in the face or leg or arm. It's normally one-sided. It can also lead to just sudden confusion. You are there and you just can't think straight. There's something not quite right. You feel some headache and you just seem to be out of sorts. You can't get yourself together. You have trouble speaking or understanding, or sudden trouble seeing with both eyes. Any of that may be a manifestation of stroke. Or you have sudden trouble walking, you have sudden dizziness, loss of balance or coordination, or sudden severe headache that cannot be explained. Any of that may be manifestations of stroke. Now, as it is with heart attack, if you think you are having stroke or somebody else is having stroke, then you need to act very fast. Now, we have a small acronym we used to remember. Act fast if there's a suspicion of stroke. So what does act fast basically mean? Act fast, F-A-S-T. Look at the person's face, ask the person to smile. If they smile and the face is twisted, ask them to raise their arm. If they are unable to raise one arm or the other, say something for them to repeat. If they are unable to repeat the sentence you just gave them, then you have to act very quickly. If you say any of these things, a change in the facial expression of the person, an ability to raise any of their limbs, and a muffling of their speech, that is very likely to be stroke. You don't have time, act quickly, get an ambulance or get them to the quickest place where they can see. What are the leading risk factors for stroke? A lot of the ones that affect heart disease also causes stroke here. So high blood pressure, high cholesterol, smoking, diabetes, carotid artery disease, very similar to what happens in the heart. So instead of the carotid vessels are the vessels that supply the brain. So just as the coronary arteries, the arteries that supply the heart can be blocked, so can the carotid arteries also be blocked by clots or other brain structures. And if that happens, a person can inadvertently develop stroke. Obesity and physical inactivity, any of these are risk factors for stroke. Again, most of the things we've said about heart disease apply here. How do we prevent it? The same things. Watch your blood pressure, make sure your cholesterol is controlled, check for diabetes, keep your weight down, and do physical exercises. Now, we will go through this again and again, but the point we are trying to make really is that there's nothing that informs you that you are not well until you go to check. A lot of us don't really like to go to the hospitals, but from age 40, please, you need to see a doctor whether you like it or not, from time to time, to get these features checked. Because if you don't actually test for your blood sugar, you will never know it is high. and you understand why from our discussion on diabetes. So diabetes is basically a production of an absence or a diminishing of your insulin production from your pancreas. So your pancreas sits just below your stomach and produces this hormone called insulin. Insulin is an immigration officer who basically decides how much glucose goes into your cells. That's a very important function of the body, because if everything you eat, all the junk you eat is admitted into your cells become a garbage center where every rubbish goes in there and will destroy the cells. So insulin is a hormone that basically gatekeeps all the nutrients that are coming into your cells, and ensure that you have just enough, and everybody else that is not needed doesn't have passage into your cells. Now, what happens if they don't get passage? Well, they float around the bloodstream and they settle in vessels and cause all the problems we have discussed before. So diabetes is basically a lack of adequate insulin to admit enough glucose into your cells, therefore allowing your blood sugar to be always very, very high. It doesn't only work on blood sugar, it also controls the amount of protein synthesis and fat deposits in your blood. So if you don't have enough insulin, apart from the fact that you get a lot of blood sugar in your bloodstream, which will then be converted to fat, which will then deposit in your vessels, it also damages the high sugar levels in your blood, damages your heart, damages your liver, damages several things that we're going to talk about in subsequent slides. So diabetes refers to a deficiency of insulin or the body having a decreased ability to use the insulin that is produced. We call it insulin resistance. So your body is actually producing insulin, but your body just cannot utilize it. Insulin is a hormone that is secreted by the pancreas, and as I said, its main aim is to get glucose into the cells. I've talked about all of that. If diabetes is left untreated, the glucose and the fat levels remain in the bloodstream, and over time will damage the vital organs and contribute to not just heart disease, brain damage, eye problems, kidney disease, and so on. There are two types of diabetes. So there's what we call the non-insulin dependent diabetic. That is the more common one. That's the one that most of us from the age of 40 will have. And then we have the insulin dependent diabetic, or the type 1 diabetes, which normally occurs from childhood. So most people who come from families with diabetes will either develop a type 1 diabetes, which means that they have diabetes from their teenage years, or they'll have diabetes when they are much older. Now, whatever diabetes you tend to get, the effects, the manifestations, the damage it causes is still the same. So about 95% of those who have disease are obviously those who pick it up at the later part of their lives. Over a third of people with diabetes do not know they have the disease. So remember me talking about the fact that these big 5 boys are silent killers. They basically will be damaging you without you realize. And that is the reason why it is important for you to go and check. I lived in the UK for some time, and I traveled to visit a friend in Canada. And we were talking about the Canadian health system. And there was a lot to be said for the Canadian health system. They, at the end of every year, from I think age 40 or so, will invite you into the clinic to come and check your blood pressure, your cholesterol, your kidney, most of these screening tests that I've just talked about. And they do that from age 40. I mean, I came away from Canada thinking that every country must do this. And indeed, we here in Ghana must do this for ourselves, even though we don't have a healthcare system that will throw out an invitation to us. It's really important that once you've gone past the age of 40, every year make an effort to go and get seen or go and get screened. I mean, I'll talk to you about some of the things we are doing that can make it a bit easier for you. Adults with diabetes have heart disease death rates 2 to 4 times higher than those without diabetes. So once you pick diabetes, you really need to be watchful, because your risk of heart disease and indeed other complications such as stroke and kidney disease is much higher than those without. Heart disease and strokes account for 65% of deaths with diabetes. I've made this point before. If you do have diabetes, your risk of dying, not just from diabetes, but from heart disease and strokes are much, much higher. Diabetes is the leading cause of new cases of blindness. A lot of people start having difficulties with their vision, and it will be because they have diabetes for over 10 years and they are not aware of it. They've not been checking it. Diabetes is also the leading cause of kidney disease. The risk of stroke is 2 to 4 times higher in diabetics. Diabetes also affects your sexual function. Okay, some people say, oh, if they don't want to treat it, the drugs cause affect their sexual function. No, the diabetes will actually damage your sexual function much faster than any drug can do. It is more common. Diabetes is very, very common among Blacks and Indians. So in the Indian population, about between 11 and 12% have diabetes. In Ghana, I read a statistic somewhere that 9. Okay, right, okay. I hope you can hear me. Jacob?
Yes, Kobe, we can hear you clearly.
Okay,
good.
Okay.
I'm just trying to tell you that we have about 18 minutes or so left.
I will speed things up. So as I said, diabetes will go undiagnosed for many years unless you go out to test for it. What are the symptoms that may suggest to you that you need the testing if you're going to wait till then? Frequent urination, excessive thirst, becoming hungry when you've just had your breakfast just 2 hours ago, unexplained weight loss, increased fatigability, and then impairment of your vision. Any of these should alert you to a need to screen. But I will suggest that you don't wait for these. Please screen yearly if you can. Kidney disease. Now, kidney disease is one of these organs that depend on other people to keep it healthy. So if your kidney is damaged, it's because something else is actually causing that problem. The work of the kidney is basically a filter. It basically filters out all the toxins that are in the sort of food we eat or whatever things we ingest. Now, for most people, it goes undetected until the kidney is failing. In fact, the problem with kidney disease is that if you're going to wait for the problems, the manifestations of kidney disease, you are in a very late stage. It will never present in early kidney damage. It will only present all its manifestations when you are at the end stage of your kidney disease, and it's very common among African Americans as well. So there are no symptoms until the kidney is actually failing. People do not know that they have kidney disease. The only way they find out is through a urine or blood test. You do notice changes in your urination, and then you notice swelling of your feet. But by the time you see swelling of your feet and your face, you are in grade 3 minimum. So you don't want to go there. You want to test it at least every other year to ensure that your kidneys are functioning right. And in fact, if you have blood pressure or diabetes or any other chronic condition for which you are on medications, please test it again. Again, there are quite a few things, but most of these features you only pick up when you have a very, very late disease. If your kidney stops working completely, then of course, you are not able to excrete all the waste products that you have ingested. The toxins being in you also lead to confusion, coma, and sometimes seizures. If kidney disease is presented at a stage where it cannot be treated, then of course you have to go on dialysis. And we all know you have to go on dialysis or get kidney transplantation. And we all know the costs involved in having dialysis in Ghana. How do you prevent kidney disease? My simple answer is please test yearly. Of course, drink a lot of water, exercise to ensure that your blood pressure is maintained. Keep a proper weight, avoid smoking, avoid over-the-counter pain medication. And in talking about over-the-counter medication, I would also say that please be very careful about the plethora of herbal preparations that are on the TV and everywhere around us. These are very dangerous medications that can speed up the destruction of your kidney tissues. People with diabetes can prevent or slow down kidney disease through monitoring their blood pressure and their glucose. People with kidney disease must also maintain low protein and low salt diet, take their medications, and follow up with their health professionals closely. It's one of these conditions that if you are told that you have early kidney damage, please be a regular visitor to check your kidney. And as long as you are doing the right things, keeping your blood pressure under control, if you do have diabetes, managing it well, you tend to actually have a fairly healthy lifestyle despite it. Right, I'll quickly go to the last one, which will be prostate. So for men, you cannot discuss men's health without talking about prostate. And prostate is the small gray colored organ in my picture to the left as well. Yeah, to your left as well. Now, it's about the size of a walnut. It's responsible for producing alkaline fluid that mixes up with your sperm in an ejaculate. It's responsible about 70% of the fluid that comes out of any ejaculate. The reason why it's alkaline is that the vagina is acidic and it neutralizes the acidic medium in the vagina, and also provides nutrients for the sperms as they swim up into the uterus. A very, very important organ, but it's also a hiding place for two of the most concerning conditions for men. And this is specifically prostate enlargement and prostate cancer. Now, breast cancer is the commonest cancer among women. Prostate is also in men the commonest cancer among men. And the only one that used to supersede it was lung cancer. But because of general reduction in smoking, prostate is now, certainly among Black people, prostate is always the big deal. So as we can see here on the picture to your right, the prostate sits just below the bladder. So the big circular structure with a pink interior lining is your bladder. Now, a tube runs from the bladder through the prostate and comes out of your penis for you to pass urine. So the prostate is basically, it kind of circles this tubular that we call the urethra as it empties urine from your bladder to the exterior. Now, when the prostate becomes very, very large, it begins to block this tube. And when it blocks this tube, the urine then begins to collect in the bladder with nowhere to go. Now, so there's a backlog and back pressure of the urine within the bladder. And then that back pressure then begins to extend into the little tubes that go from your bladder to your kidneys. So over time, if this is not managed well, it destroys your kidney. Now, this condition is called BPH, or benign prostatic hypertrophy, enlargement of your prostate glands. It is described as a clamp on a hose. So if you have a hose that is pumped, that has water coming through it, and you put a clamp on it, that's exactly what happens with prostate enlargement, blocking off the free flow of urine from your bladder. It causes what we call bladder outlet obstruction, and it has all the consequences I've just described: urinary retention, infection, kidney damage, and so on. Now, how do you know that your prostate is enlarging? Well, you tend to go to the toilet a lot. So when you go, you pee small, and then you are done, and before you know, in 2 hours, you want to go and pee again. Now, whenever you want to go and pass urine, there's a sense of urgency. You need to go there, otherwise you get an accident. And then at night, you wake up more than 4 times to go and empty your bladder. And then when you have emptied your bladder, you don't feel like your bladder is completely empty. You also have something we call hesitancy. Hesitancy is when you go and stand there, you are trying to empty your bladder, but it takes a long time before the first drops of urine comes out of your bladder. That's hesitancy. And again, that's a sign that your prostate is getting bigger. And there's also, as I said, incomplete emptying of your bladder, straining. Sometimes you have to strain very hard to get your urine out. And then when the urine starts to come, it doesn't flow in the nice stream that it used to flow in anymore. And at the end of you passing there, you notice that it's dribbling for quite a while before it completely stops. So all of these features suggest that your prostate may be enlarged. How do you know? Well, if you go to a physician, they will examine you. They'll put you in a particular position and examine you from your back, and they're able to tell that your prostate is enlarged. But these days, a lot more people will just do ultrasound. So an ultrasound of your prostate would help us determine the volume of the scan and be able to tell you if your prostate is enlarged or not. The other thing we also do is that we do what we call PSA, or prostate-specific antigen. So a prostate-specific antigen also goes up with enlargement. Now, prostate-specific antigen also very important for making a diagnosis of prostate cancer. Now, if you have slightly raised PSA levels, but not so raised to the point where we think this is cancer, then you very likely have prostate enlargement. So what we're saying is that if you test your PSA and it's less than 1, you are very likely to be normal. If you test your PSA and it's more than 1, in fact it's 2.5 or more, then it's better for you to go and check whether you have prostate enlargement. If it's more than 4, then we have to be thinking about prostate cancer. Now, prostate disease or benign prostatic hypertrophy is age-related, so that as we all grow, our prostate gets bigger and bigger. 50% of men by the age of 50 will have some enlargement of their prostate. In fact, by the time we are all 100, all of us will have some moderate prostate enlargement. If you have a family history of prostate cancer, then it's always a good idea to check earlier. Now, so I'll just talk quickly about prostate cancer.
Hey, Kobe, I don't know if you can hear me. We've lost you. All right, guys, so it seemed to have lost Dr. Apiasechi. I think maybe his network. Give me a minute and I'll try and reconnect him.
Colleagues, thank you very much. We are still waiting.
Hi, I've spoken to Dr. Apiasechi. I've asked him to exit the meeting and rejoin. So, Okwabi, I think it may be an idea that whilst we wait, given the time pressure, I don't know if you want to run through your announcements whilst we wait for him to rejoin. At least we utilize the time. What do you think? Gentlemen and a lady, any objections to that?
Good idea,
it's
bro.
a good idea. It's a good idea.
Okay. Okwabi, do you want to run through it or do you want me to go through it? So I believe we have 2 key items in terms of announcement.
Jacob, I'm here, so if you want me to finish.
Oh, all right, Kobe, please take over and let's finish it. We have 5 minutes more, so if we
Jacob, just go through the announcement, sir. It's your day.
All right, Kobe, let's take the announcements. You wrap it up and then we can take
That's fine.
At least that
No
way,
problem.
those who have questions can choose to remain.
No problem.
Okay.
That's fine.
So,
Go ahead.
I think we have 2 key announcements, really. The first one being that the next meeting will be hosted by the US group. I think Maputo will be the lead, and they'll be hosting it next month. Sorry? Okwabi, type your comments. Your voice is not coming at all.
The floor.
Sorry? Rance, we can't hear you. What about what? I suggest you type your comments and then at least I can read it out. So as I was saying, the US would host next month's meeting. As I said earlier on, I think this is our first Sunday for the meeting. So the leadership would appreciate your feedback on the timing and also on hosting this meeting on a Sunday. So do reach out to the leadership with your feedback. The next announcement is that on the 9th of October, we have to go and support our sister Irene Kwate-Papafield in the burial of her mother at the Mount Ararat at Bubuashi. So please do well to go and support, and also the usual financial contributions that we do to support our friend and colleague. Dr. Apiasechi, I think you're free to take over the meeting now, so you can finish your slides and then we'll take questions. That way,
Jacob, where did I start talking about prostate cancer before I fell?
You were talking about not that slide. Go on to the next slide. No, actually, you've almost finished the previous slide. I think you were talking about the PSA monitoring.
Okay, right. So it will be this one, right?
Yes. So you go. Yes, you were finishing. You were towards the.
You
talk about
finish
PSA monitoring and family history.
Okay, fine. So anyway, this is an important slide. So let's just try and finish it. So what I was saying was that normally we will say that from age 55 to 69 or 55 to 70, you need to test it every 2 to 3 years. But if you have 2 people in your family who have had prostate cancer before, then we will suggest that you start actually testing from 40. Now, if you are between 40 and 50 and you test your PSA and it's more than 2.5, it's abnormal, please get somebody to see you. If you are, 55, 60 and upwards and it's more than 4, again, then you need to be thinking about proper scanning, biopsy, and so on and so forth, because it's quite high for just an enlargement. So summarizing what I'm saying, essentially what we are saying is that if you are 40 and more, think about your health and think about it not passively but actively. Eat a healthy diet. There's a phrase that at this stage of your life, you eat to live, you don't live to eat. And I'm sure we've all heard that. You have to think very carefully what you're eating and make sure it's healthy. Keep a healthy weight, adequate sleep, avoid smoking or stop or reduce alcohol intake. And then get used to routine screening. I can't say that enough for men because we never really care about these things till we are very ill. Get used to going to the hospital once a year, check your blood pressure, check your sugar, check your cholesterol, check your stools. I did not mention stool for bloods at all in my presentation, but we know that among blacks, colon cancer is also one of the problems. So these are the screening tests you need to do: your blood pressure, your cholesterol, your blood sugar, your weight, your PSA, your stool for bloods, and your kidney tests. These are tests, if you can, at our age, please check here. So I'll finish off with a few commercials. So this is our hospital in Tema, Community 22, where just opened 2 years ago, and we basically what we are doing is just setting up a UK hospital in Ghana using UK protocols for care. I'm also part of a team called Ginger that is providing healthcare for folks whose parents are in Ghana and they live abroad, or in Ghana and they don't live with their parents. They want their parents seen at home. We have a team that also go home to see folks' parents and indeed themselves if they want healthcare at home rather than in the hospital. So I think that's it. I mean, these are the things we do: medical appointment, labs, video consultation, home care, elderly care, and so on and so forth. So that's Ginger. If you do need our help, do contact us. I think that will probably be the end of my presentation.
Thank you very much, Dr. Apiasechi. Thank you for a comprehensive presentation on men's health, and most importantly, the advice on monitoring and also some of the lifestyle changes. Now, guys, I'll share the details with you later on, but let's take questions. I have some questions that came through the chat, and I'll read them out. The first question is, Dr. Apiasechi, is the you mentioned BMI. The question says you mentioned BMI and ethnicity. I'll summarize the question, and it's around BMI, ethnicity, and also family history. The question is seeking clarification on how BMI that has been designed by the West is suitable for the Ghanaian or Black population. And if you can just spend maybe 10, 15 seconds to at least give an overview of it, and then.
Well, that's a very good point. And indeed, the data that was collected for use in designing these nomograms were collected in the West. Now, I'm not sure it's completely accurate to say that they were racially biased. I'm sure the African American population played a significant part in the sample groups that were, and whether we are like it or not, it still applies quite well. Even if you forget about we in Africa, but even if you use the African American population in the States or in Canada or in the UK, it still fits quite well that when people control their BMI, regardless of their ethnicity, it really impacts on their health. So I wouldn't want to politicize this at all. Please, it's something that we should respond to.
Awesome. So if I hear you correctly, it's a good thing. Be aware of your BMI, monitor it, and try and control it. Really is the key message.
Yes.
Awesome. We have a much simple question here, which is saying exercise, running or walking, which one is good? Which is more effective? Which is actually the question is, what is more effective, walking or exercising? I'm not sure what.
In terms of exercise, people do swimming, people do climbing mountains, whatever you do. Now, what we say is that it should be something that impacts in your heart, i.e. causes your heart rate to go up and make you sweat. Okay, and it should a minimum of 30 minutes, 3 times a week minimum. If you could do it daily, fantastic. Right? If you cannot do it daily, 3 times a week of very, very brisk walking that makes you sweat or break out in sweat, that is effective. That doesn't matter whether it's running, walking, swimming, you pick your choice. As long as it's doing this for you, making you break out in sweat, and for a minimum of 30 minutes. You know, I will say that when I used to live in Qatar, I used to walk for 15 miles. Okay, so 15-mile stretch, and it took me 2 hours or something like that. So for us, if you cannot do the every other day, then have a long walk once a week. That's also effective.
Okay, so exercise regularly. Make sure that any activity that raises your heart rate at least for half an hour is a good thing. Thank you. Then I have one which is quite sensitive. I'm not sure if it's sensitive or very culturally specific. It's around the herbal medicine. So the person who asked the question quotes you as saying dangerous. You use the word dangerous to describe herbal medicine. I think there's people here who feel quite strongly about herbal medicine. Now, without putting words into your mouth, I think what you were trying to say is have a cautious approach, because these things have not been the potency is not known some of the case in most cases. So I don't know if you want to shed light on that, just so that people are clear on that it's not knocking herbal medicine, but it's saying most of us here are over 50. We need to be cautious with the use of herbal preparations.
So I came back into Ghana in February this year. My uncle passed away in October. My uncle was 65-year-old. He wasn't a very unwell man, but he will not listen to me when I tell him, "Uncle, please go to the hospital and make sure it's a hospital that is looking after your sugar and your hypertension." And this is not an anecdotal story. We have so many of these kinds of things. People being told that their hypertension will be treated completely, their diabetes will be treated completely, and I'm sorry, it is not completely correct. I have no problem with any medication anybody wants to give anybody, but please, we live in the time of science. It must go through scientific rigor. If it doesn't, then the rest of it is just noise. And there's a lot of noise you hear in Ghana. I'm very happy to have a sensible debate about anybody who wants to have a debate about it. But you must present to people something that is evidence-based. If it's not evidence-based, you are actually selling a very dangerous product. It is not what we say about medicine which is important. It's what it actually has been tested to do, which is important. And in Ghana, we seem to have forgotten about scientific rigor, and people are just talking. And I have a big problem with this. Okay, and of course, won't I? I'm a physician. Okay, but the fact remains is that for time immemorial, there've always been quack doctors trying to sell things, including now. And we have to be very, very careful what people tell us and what we believe. And my answer is that simple. So if I describe it as dangerous, I'm not apologizing for it. There are a lot of them there that are dangerous.
Right. We have 2 more questions. I'll try and wrap it up. Guys, I'm just reading the questions on the chat that's been sent to me. Feel free to unmute yourself and ask questions. One is quite simple. I think it's around the recovery of strokes and the onset of the disease. The question is, what are the chances of recovery when someone suffers a stroke? And can you emphasize on the relationship in terms of intervention of the disease at the time of intervention and the impact of recovery? I don't know if I've articulated that very well. But basically, when someone suffers a stroke and they get rehabilitation from the beginning, is that better? Does that give a better prognosis than when they are later on in later stages of the disease?
Right. So if you suffer stroke, what is the prognosis for you? What is the outcome? What is the chances of you coming back to normalcy? There are a number of factors. One, how quickly it is identified and dealt with. Two, the extent of the damage to your brain. These are probably the two most important features. So if it's a big clot that affects some of the big middle vessel actually that supply this entire side of your brain, and that is blocked, that is a massive stroke. Now, when you have a massive stroke like that, a lot of things will not be working. Your heart will not be pumping right. Your speech will be gone. You will have real weakness. So the extent of your stroke is one, and two, how quickly it is dealt with. And that is the reason why there's this acronym ACT FAST. Now, this is where obviously not living in the West becomes an issue. Like, even if you live in the West and you don't get the right medication at the right time, you will get into trouble. But if you're able to act fast and they see a massive stroke, they're able to put kit into your brain, go to where the vessels are. There are machines that can tell where the vessels are, and then they can break it down quickly and then restore circulation in your brain. And if it's done very quickly, you're very likely, despite the size of your stroke, to actually recover quite well. So if it's a minor one, we get it early, give in the medications, and start the appropriate physio. Again, you are likely to come back to normalcy. But if it's a big one, affecting a large area and was not dealt with quickly, then in the same way, you are unlikely to restore most of your functions. Now, while I'm talking about, let me also say that there's something called TIA. TIA is ischemic attacks, transient ischemic attacks, where you get something like a little stroke, but then you are well again. When you see that, when you have some weakness or some speech impairment and everything is fine again, especially if you have underlying diabetes or hypertension, please get seen, because you are likely, it's a warning of worse things to come. So if you have had TIA or some kind of a warning early stroke, please get seen as quickly as possible. I don't know if that answers your question, Jacob, please.
Yes, I think that's a reasonable answer, given the time constraint. I have one final question. Well, actually, I have another question on discounts from Ginger, but we can discuss that at a later date. I have a question, first of all, Dr. PSH, well, from a boys' school, so some of the questions has got a bit of, how's the most politically correct way to put it? But the question is around, now, the reason why I'm going to ask the question is because the question is around, what do you do about the nagging wife? Do you divorce her? That's the question. But I think the reason why I asked the question, Dr. PSH, is for those who missed the initial part of the meeting, Dr. PSH is a OBGYN consultant as well. So I think it's also an opportunity. We do have ladies on the platform. I think it's also an opportunity to maybe articulate maybe some of the symptoms of menopause, so we as men can be aware that when our wives and our side chicks, I beg your pardon, our wives are experiencing these challenges, we can have a better understanding so that we're able to cope much more. I don't know. Do you have any comment on that? Are you frozen or are you
Jacob.
You're frozen. You're frozen. This is what they say, saved by the bell.
Can you hear me, Jacob?
We can hear you now. So basically, you know, awareness of menopause and the symptoms and how that impacts the marital relationship. Right.
So yeah, well, so at our age, if we have wives or partners that are our age, they will be going through menopause. But I think it's a bit unfair to say that all women going through menopause are nagging wives. They are not. However, let me stay with the man first. So if you have difficulty with communication at home and you have an underlying condition, then you need to be a bit more careful, because the irritants that can cause either to despise your own health or ignore it, or the irritants that can cause your condition to worsen are there. And therefore, it's important to start by saying that you need to be very watchful of your own health. That's the first thing to say. So you need to be a regular visitor to healthcare facilities to ensure your own health. That's the first thing. The second thing is that, you know, a nagging wife is probably a nagging wife, all right? So I'm not entirely sure whether, if you think it's menopause related, then yes, encourage your wife to go and see an obstetrician gynecologist, and we can do something to help. I think we have a pastor on the floor, so seeing pastors will also be somewhat helpful. I'm not so sure that if we've had 20 years of a nagging wife, treating them when they are menopausal will be generally a good idea. But that's all that you can get as an answer, a funny answer from an obstetrician, I'm afraid.
Right. On that light note, I think if we don't have any more questions, I'd like to draw this month's meeting to a close. For me, the key message really is
Jacob, I said I had a question, you ignored it.
I beg your pardon, Mr. David Squire. Please go ahead.
Right, Dr. Kobe, my question is centered around the prostrate stuff.
Yes.
I have a very different, my lifestyle has been very abnormal from childhood, you know, like when it comes to my sleep pattern, from an early childhood year, I've been sleeping. My maximum sleep hours, I would say, it's about 3 hours. If I get a 4-hour sleep, that is really, really good for me. And that has been the way I've lived my life till now. And I've seen doctors, they tell me it's all right. When it comes to urination, when I go to bed, I wake up about 10 times since my childhood, 10 times a night to urinate. So you could see that my sleep pattern is very irregular, you know, and doctors tell me because that is my kind of lifestyle, it's nothing to worry about. I've had I think 2 years ago, I had the prostate check in the UK and it came out very, very good. So what do you have to say to someone like me? I mean, because from what you've been saying, I should be very, very worried, but you know.
No, I'm not so sure I'm saying you should be very, very worried. But so let me deal with the sleep issue. So now I sleep 4 hours and then I have to wake up. But then I get up and do stuff and go back and sleep again because I just can't sleep through a night. And that's again being me. Now, it's very important. So as a general rule, as you get older, you tend to use the loo a lot. I'm not entirely sure whether you've been investigated, because if you've been investigated, you've been told that it is okay to pass urine, up to 10 times a night, then that's fine. But in medicine, if you are passing urine more than 4 times, we call it nocturia. Nocturia is a feature of an issue with your bladder. So I don't know, have you ever seen a urologist?
No, not since, like I said, it's been from childhood and I haven't seen one, but I've spoken to my doctors about it and I think they just assumed that because it's been like that since childhood, it's normal with me.
Yeah, well, so find some time to go speak to a urologist, I would suggest. Because the urologist would explain to you why it was like that in childhood. I won't speak to just any general pediatrician. I will speak to a urologist about it. Now, the sleep patterns, if that's what works for you, that's what works for you. But I will say that, particularly if as you get older, it's even getting worse. So now it's from 10 to 12 to 15, a time will come you have no sleep at all. So you really need, as I said, discuss with the urologist and see what you can get to do about it. But you definitely must find a situation where you either sleep for the 3 hours, wake up, and then go back to sleep. Because as you get older, you really will need a little more sleep. It doesn't matter how you do it, whether you sleep early, get up at midnight, work a little bit, like I do that all the time. And then towards the morning, I'll go and sleep again. But try and increase it by maybe having the breaks in between. Because if you're actually using the loo 10 times, you really are not sleeping even the 3 hours you're talking about.
Yeah.
So I will suggest that you actually go see a doctor, have a sort of an open discussion with them, and they will tell you, and if they reassure you that, well, you've done this in childhood, so there's not a lot that you can do about it now, you just have to live with it, then that's fine. But whatever it is, your sleep should not be less than what you are describing. Because what you're describing is just about the minimum you can get. And as you get older, you really need to sleep more to be able to prevent overuse of your brain, leading to all the other problems I've described.
All right. Thank you very much. Thank you.
Okay.
Right. As I said, I want to be respectful of your time. I don't think we will go beyond 5:15. I have one final question, which is also quite a personal sort of health-related question. I experience dizziness frequently, but all my vitals are normal. What do I do?
So 2 things. Go do a coordination test. Coordination test, your brain is responsible for how you put your watch on and all this. That's coordination. And then go check your ears. So these 2 things are important because your balance is related to both your ears and your brain. So if you experience a lot of dizziness, then check that your ears are all right. And then if your ears are okay, then they should check your brain because your coordination may be the reason why you're losing balance or becoming dizzy. That's all I was saying.
Yes, I would like to add some personal experience to that. That's correct. I have what's described as a mild balance disorder, and I do see I actually go to a balance clinic, so I do see the ear specialist, and they check the inner ear. So that's pretty sound advice. Right. Thank you, Dr. Kobe. It's been an absolute pleasure to have you. We have great participation from the team. Before we do the closing prayer, I think the key message is, as I said, be aware of your body, be aware of your vitals. Make sure you go for regular checkups and exercise, even if it's 30 minutes, whatever exercise. If you notice, the doctor did not specify which exercise. Anything that raises your heartbeat for half an hour, as long as you can last for half an hour, you're on a good path. Thank you. James Kessim, I would invite you to say the final prayer for us, and we can draw this meeting to a close. Okay. You have to unmute yourself.
Can you hear me?